Which is a better career option, nursing or physiotherapy? Well, both are very lucrative. But in order for a nursing courses, there's a thing that you need to become a part of a good or at least a respectable hospital or nursing home or a private or a public place. But the problem is, many of the cases getting a job is not that easy and you are restricted. Private nursing doing is also very hard. Okay, you cannot just do privately. But if you do BPT courses, then it becomes very easier for you. Okay, so you can get in touch with the direct clients. Even the doctors also recommend their private physiotherapist at their hospitals to encourage you to go and have a private session, and their private sessions goes up to 1,000 per hour as well. Okay, so both this is the thing. But in nursing there are specialized things. When you become a head nurse after a few years, then your income can go really high, which cannot go in the physiotherapy in the beginning. If you're as an average physiotherapist, you cannot go that high, but even as an average nurse you can rank higher and earn higher than a physiotherapist. But the problem is, with due course of time, there will be when you physically become a little bit weaker, you can't go from one place to another place, then nursing will become easier for you. And remember that nursing is not always restricted to girls. Even men can also become good nurse as well. Okay, although in India there's a concept of this, but nowadays this concept is also changing. Money wise, if you say, the course fee of nursing goes from 20,000 to 2.5 lakh, whereas physiotherapy is at a relatively lower part. Okay, 15 to 20, 12 to 15,000, it goes around 1.25 lakh to 2 lakh. Salary package for a physiotherapist in some cases, even I would say, is little bit higher than the nurses. Okay, and some cases nurses has to do some kind of stuff which you may not like. Okay, you can understand what are the kind of thing, like emergency room nurses, home nurses, or junior nurses, junior pediatric nurses, psychiatric nurses. So it's like a relatively harder job. But relatively, you work with musculoskeletal physiotherapy, you work with cardiovascular, you work with pediatric, you work with the women health, these kind of fields. So these physiotherapists are relatively easier, and you can work on the lectures, you can write some things. So as a nurse, you cannot write your own paper. Okay, it's not very much in the acceptability criteria, but as a physiotherapist you can. So my vote actually goes for this thing, but in some cases my vote also goes for the nurses. But remember that there is nothing called female or male, but nowadays female physiotherapists, they can go, and you get a good amount of female clients as well. For a male physiotherapist, it's almost impossible. My mom personally, if I give her example, so I know a lot of good physiotherapists who are really good. They have done your master's courses, they're writing papers, but my mom prefers a female physiotherapist who is not that much educated, doesn't have a degree, but she prefers hard. Okay, the thing is that, but there is maximum age limit is not applicable for nurses, but for physiotherapy it is 35. Minimum age is around both for 17. Graduation marks for 45 to 50 will do. So in many of the entrance things is this. So you, at the end of the day, the choice is always yours. But if you ask me, my vote goes on evenly for both of them.